Meningitis is a fairly rare illness consisting of the inflammation of the meninges. The meninges protect your central nervous system, alongside the cerebrospinal fluid. They consist of three separate membranes that surround the brain and spinal cord. They are called the dura mater, the arachnoid mater, and the pia mater. Meningitis comes from infections, usually a bacterial or viral infection, and occasionally a fungal infection.
Viruses are smaller than bacteria and require living hosts to multiply and survive. They are made up of a protein coat and a core of genetic material, either DNA or RNA. They attach themselves to cells to multiply and either reprogram the cells or turn them into malignant or cancerous cells. Viruses are specific about what cells they attack. A common example of a viral infection is influenza. In contrast, bacteria are more complex and larger than viruses. They are single-celled and are made up of a rigid wall, a thin membrane, and fluid inside the cell. Bacteria can multiply without a living host. Most bacteria are harmless and they can be good or bad. In order to treat bacteria, people use antibiotics. A common example of bacterial infection is pneumonia. Both bacteria and viruses are spread in the same ways by coughing and sneezing, physical touch, such as shaking hands, through the intestines, such as touching food with dirty hands and then eating it, and bodily fluids such as blood, saliva, and semen.
Viral meningitis tends to be less severe than bacterial meningitis, but more common, affecting 10 in 100,000 people each year in the United States. Viral meningitis can be caused by many different viruses, including those starting in the ears, sinuses, or upper respiratory tract. With viral meningitis, you are less likely for permanent brain damage. Symptoms for viral meningitis develop over several days, such as a stiff neck, headache, and fever. Usually, viral meningitis will clear by itself after a few days. Bacterial meningitis is a lot more fatal than viral meningitis, as well as less common, affecting 3 in 100,000 people in the United States every year. Bacterial meningitis is very serious and requires immediate medical care. If not treated quickly, it can lead to permanent brain damage or death within a few hours. Many different types of bacterial infections can cause bacterial meningitis. Usually the three types of bacteria that cause it are Haemophilus influenzae type B, Neisseria meningitis, and Streptococcus pneumoniae. It develops when the bacteria gets into your bloodstream, starting at a spot such as the ears, sinuses, and so forth, and travels up to the brain. Symptoms come on quickly over the course of a few hours. This meningitis can be extremely contagious when in close contact with someone infected. Fungal meningitis is a rare form of meningitis, especially in healthy people. Generally, it only occurs in people with weak immune systems or impaired immune systems, such as one that is AIDS infected.
Common symptoms include high fever, stiff neck, headache, nausea or vomiting, sensitivity to bright lights, seizures, rash, sleepiness, and joint pain. These symptoms usually show up after the infection or flu. For children under the age of 5, it is usually harder to tell, seeing as they cannot talk. The symptoms for them include fever, irritability, lethargy, difficulty feeding for infants, high-pitched crying, crying when held, pale or blotchy skin, and an arching back. In order to diagnose, a doctor will usually analyze a sample of your spinal fluid.
Although it can be very serious, meningitis is also preventable. The easiest way to prevent it, or to be at lower risk, is by having or maintaining a strong immune system and good health. Vaccines and generally just being aware are also good ways. Meningitis is more common in colder months and can appear mild and rapidly escalate.
My grandpa had viral meningitis at the age of 17 when he lived in Finland. He was playing indoor soccer and afterwards he went to have a shower and then had to walk 3 kilometers home in minus 35-degree weather. He soon got sick, and then they tested this by him lying down on his back and getting him to touch his chin to his chest. He could not do this due to how stiff his neck was. His meningitis was not so severe and eventually went away on its own. My grandfather's brother, Tommy, also had meningitis. However, he had bacterial meningitis quite severely. During the Second World War in 1944, my grandfather Ed and his brother Tommy lived in Sweden. At the time, Tommy was 2 years old when they were playing on a beach and he picked up a bacterial infection. Due to wartime, there were not a lot of doctors around, and Tommy was soon hospitalized. When this happened, they moved back to Finland, where my grandpa was born. Tommy suffered major brain damage, and they were unsure whether he was going to live. He started to suffer with epileptic seizures, and his conditions always seemed worse after each one. In the beginning, he had these seizures frequently and quite badly, and still suffers from them today, even after on medication. Tommy had to relearn how to walk and how to talk, as well as to go through physical therapy. He didn't learn how to walk until he was 6 or 7 years old, and he didn't learn how to talk until he was age 10 or 12. Tommy was classified with the intelligence of a 5-year-old at age 20. However, this never stopped him, and he's continued to live a normal life as well as he can, despite the brain damage. Tommy married in Finland to an average girl. However, she treated him poorly, and it was not long before my grandpa stepped in. It was when Tommy was around age 30 when my grandpa moved to Canada and decided to take Tommy with him. When they got here, Tommy lived with my grandparents for the first while. In Canada, Tommy learned to drive and got his driver's license around age 30. He would still have it, however, he lost it due to crashing from an epileptic seizure. Tommy remarried at the age of 60 to a girl who is also special needs, and they're the happiest, funniest couple around. Now Tommy lives on his own and is able to do everyday activities all by himself. My grandpa goes and visits him every day, as well as helps him out with things such as finances and bills. Tommy can talk normally and walk. He speaks both Swedish and English, loves to garden, clean, goes for walks, and go to church. He can make his own frozen dinners, and he loves kids. Him and his wife own 2 pet birds that they care for. Although bacterial meningitis can be extremely serious, it does not mean that it is unbeatable.